In today's news, the Public Health Ministry says it plans to declare COVID as endemic earlier than planned. A lung specialist denies that booster shots cause cancer of the immune system, and authorities refuse to grant bail to a 20-year-old political activist.
Today's show is brought to you by Thaiger Property. For all your real estate needs in Thailand. Link in the description below.
สวัสดีครับ You're watching Thailand News Today, bringing you the latest top stories in Thailand and beyond. สำหรับคนไทยที่อยากอ่านบรรยายไทยเปิดแคปชั่นด้านล่างได้เลยครับ The show is made possible by our supporters, and today we would like to thank Neil Cunningham for becoming a Thaiger member. My name is Jet Gunther, and in our first story, Thailand's COVID situation is continually improving and is expected to be declared as endemic more than half a month earlier than expected. According to the Ministry of Public Health, his office originally planned to declare COVID as an endemic disease on July 1st. But yesterday, the ministry's permanent secretary, Kiatiphum Wongcharit, announced that Thailand now plans to declare the disease as endemic more than 2 weeks earlier than expected, sometime in mid-June. The ministry said the situation in Thailand is continually improving. Kiatiphum said the Omicron strain is less virulent than the common flu. Most infected people have no symptoms or just flu-like symptoms, and vaccination rates have continued to increase. An endemic disease is a disease which is limited to a certain area and spreads in a predictable way. There are 4 criteria for a disease to be declared as endemic: no more than 10,000 new cases per day, a mortality rate of no more than 1 in 1,000, immunity built in society through vaccines, with at least 80% of high-risk groups received at least 2 doses, and efficient medical treatments in place. Now, as for what will change when Thailand declares COVID as endemic, it is not entirely clear how entering the endemic phase will impact daily life in Thailand. However, there are 2 certain changes, and that is, Thai authorities will no longer have the power to quarantine anyone coming into the kingdom, and daily case numbers are no longer required to be reported. However, daily COVID cases admitted to hospitals will still be recorded. Moreover, hospitals across the nation will continue to track and collect data about long COVID symptoms. Provincial public health doctors and directors of hospitals will have monthly meetings to discuss how to tackle long COVID and move forward in the same direction. But before you take off your mask and hug a stranger on the streets again, Minister Anutin Chanvirakul said that if new variants emerge, the ministry could reconsider their classification of COVID-19 all over again. And even when COVID is declared as endemic, people will still be required to wear a mask in public places as before. A leading lung specialist at Bangkok's Wichayut Hospital has completely dismissed concerns that mRNA boosters against COVID can cause lymphoma, which is cancer that affects the immune system. According to a Nation Thailand report, Dr. Manoon Leechaweng-Wong has dismissed the concerns as a fake news, citing a long list of evidence of the vaccine's efficacy and no credible reports linking the mRNA vaccines with lymphoma. It's understood the rumor began circulating on social media and has now been widely shared by Thai internet users. The claim is said that the high level of immunity offered by mRNA boosters could trigger lymphoma. Manoon says the story seems to have originated as a result of a woman who initially thought she had developed lymphoma as symptoms after receiving an mRNA booster. According to Manoon, the 45-year-old woman was healthy and had received 2 doses of the AstraZeneca vaccine, followed by a booster dose of Pfizer in January. She then developed 2 small lumps above her collarbones, with the one on the left being larger. She did not have a fever and reported no other symptoms such as loss of appetite or weight loss. She did not have a cough, did not smoke, and had no history of tuberculosis. A medical checkup on April the 30th showed that the woman's lymph nodes were very enlarged, with the left set up to be 4 times larger than the one on the right. The woman had a lung X-ray, which did not find any abnormality. The hospital then tested a sample from the woman's left set of lymph nodes and confirmed that the woman had a TB infection, not lymphoma. A bail application from monarchy reform activist Thantawan Tuatulanont has been rejected over a missing payslip. Thai PBS reports that the criminal court denied a bail application submitted by the leader of the opposition Move Forward Party, Pitha Limjaroenrat. The reason given was that Pitha had not submitted his MP's payslip with the application. According to the court, Pitha needed to provide a payslip that would prove he receives a salary and to rule out any other reasons for granting bail. The Move Forward leader had submitted a letter issued by the Office of the Secretary General of the Parliament to clarify his salary as a bond for Thantawan's bail application. The move was in response to police seeking a court order to have the activist held for another 12 days. The court has granted permission for 20-year-old Thantawan, also known as Tawan, to be detained for another 5 days. She has been charged with defaming the monarchy, resisting officers, and violating the Computer Crimes Act. The latter charge relates to her March 5th live broadcast. The latter charge relates to her March 5th live broadcast before a royal motorcade, in which she called into question the priorities of the police and the monarchy. While farmers were protesting nearby, they had been forced to clear the area to make way for a motorcade. The court also took exception to Thantawan's decision to wear black during her broadcast, given that the color is seen as inauspicious and something that should be reserved for mourning. The activist has been held since April the 20th, when her bail was revoked for breaking bail conditions by being close to a royal motorcade and posting about the monarchy on social media. According to Pitha and Thai Lawyers for Human Rights, it's understood Thantawan has now been on hunger strike for 28 days and is reported to be very weak. Pitha has said he intends to resubmit a bail application. Low-cost budget airline Nok Air's gamble of investing in a special route to boost tourism has backfired to the tune of 40 million baht. The Thai airline, which mostly operates domestic services out of Don Mueang International Airport, introduced the Bangkok to Betong route in February, but plans to scrap it in July after suffering heavy losses. The Betong International Airport in the southern province of Yala fully opened for commercial flights in February after the opening schedule was delayed due to COVID. Nok Air teamed up with a number of different tourism agencies and the State Department to provide a direct flight from Bangkok to Betong to boost tourism in the province. But bookings never really took off, and Nok Air had to call for support from the government to cover its operational costs. The low-budget airline resumed flights on April the 29th with a 3-month contract, but Nok Air CEO Wuttipum Julangkoon says he just doesn't feel it would work. Wuttipum revealed the 1 hour and 45 minutes Bangkok to Betong route was losing money despite government support, and operational costs were too high to make it profitable. A 15-year-old male student is in serious condition after being stabbed several times by a fellow student at school. The incident happened because of a long-running conflict between the two and follows an argument the day before. Yesterday at 8:40 a.m., a Matayom 3 or grade 9 student at a school in the southern province of Songkhla was reportedly stabbed by another student in front of their classroom. The alleged attacker was a 15-year-old student in the same year but in a different class. Thai media reported that the two had an argument the day before and, according to classmates, had resolved the situation. But the assailant was clearly carrying a grudge and brought a 6-centimeter-long knife to school the next day. The victim was sent to a hospital in serious condition after being stabbed several times. The attacker remains in the custody of police officers. Police told Thai media they would continue questioning the youth together with the parents and an officer specializing in youth crime. The brother of the alleged attacker gave an interview with Thai media, noting that his brother did have a bad temper. He said he'd spoken to his brother about the incident, and the brother commented that he did not mean to stab the victim. And that's all for today's report from Thailand News Today. We'll be back tomorrow. Until then, you're now up to date on the Thaiger.